Welcome to Alpha Wolf's Den. It's here that we seek enlightenment. Alpha Wolf Trading recognizes that the most successful companies in the world at one point had no earnings. There's a lot more to a company than just its earnings report. That's why here at Alpha Wolf's Den, we interview executive teams. We want to get to know management. We want to understand the vision, the mission, the strategic drivers, the plan. We want to separate fact from fluff. This is not a paid for promotion interview. This is solely wanting to know the company's vision, mission, their critical success factors, their strengths, their weaknesses, their opportunities, and the threats. We want to know the long-term objective and the tactical initiatives that leadership plans to implement to achieve success. We want to know about the company's debt, the cap structure, what it's going to take for them to become self-sustaining and stop burning through cash. We want to know management's previous failures, challenges, hurdles, how they overcame them, or what they learned that they can apply in their current role. We're trying to identify the risk and the reward. And oftentimes, it's strong leadership that makes the difference between success and failure. Here at Alpha Wolf Trading, we are looking for the hidden gems. And I hope you enjoy this interview because this is one of those companies that I think could be a hidden gem. Please understand that this is for educational and entertainment purposes only. This is not financial advice, and I am not a financial advisor. Any investment that you decide to make in any security should be based upon your own due diligence and opinion. Hey everybody, Tim from Alpha Wolf Trading coming at you with another CEO interview from a very interesting company that I have actually recently found. Read an article and I thought it was a really compelling story. And then I met with Lisa Crossley, who you're going to meet in about 2 seconds, and had a fantastic conversation and pretty much confirmed that this is a really compelling story. And now Lisa has agreed to come in and tell the story of Reliq Health Technologies, and the ticker symbol on Reliq Health Technologies is, hold on a second, let's see, RQHTF, and that is traded on the OTC. But a lot of exciting stuff. First of all, Lisa, thank you so much for coming in and agreeing to do this and tell your story.
Thank you for having me. Yeah, no, I'm thrilled to be here.
And so you had some big news recently that really, I don't think the market, gave it the respect that it deserved. But I'm going to let you go ahead. First of all, give me a little background on you, right?
Sure.
And how you kind of got to where you are today in Reliq.
Sure. So I'm Lisa Crossley. I'm the CEO of Reliq Health. This is the 4th company that I've run as CEO. The first three were privately held and had exits through acquisitions. But this is the first private company or public company rather, that I've run, although I started my career in Boston at a biopharmaceutical company that we took public in the summer of 2000. And as the leader of the product development group, the manufacturing, I handled all of our global therapeutics manufacturing and our phase 1 and phase 2 clinical trials. So I was involved in the kind of dog and pony show around the IPO. And we had a highly successful IPO. And then a year later with 9/11, the bubble burst. But ultimately that company was acquired by Shire Pharmaceuticals for $6 billion. So my first exposure to the public markets was in the US. Reliq is a Canadian company, and we're traded on the TSX Venture Exchange as well as on the OTC pink sheets in the States. And we are expecting that the company will graduate to the NASDAQ later this year. And I think some of what we'll talk about with some of our recent announcements kind of will give you a sense of how we're going to get to the point where I think we'll really be ready to be a NASDAQ listed company. And I think that will be the appropriate home for us within really just a few months.
Okay, so yeah, you took one of my questions away from me already.
Yeah.
But yes, uplisting to a major exchange is something that I was curious, but I already knew the answer to. That you had plans to do that. So tell me what Reliq does specifically. What makes you guys different?
Reliq is a virtual care technology company. So we operate on a software as a service model, although we do provide some care management services, but by and large, we're sort of a traditional SaaS model. And we are addressing the virtual care for chronic disease market that's currently valued at over $100 billion in the US. And we are primarily targeting the US, although we do have some business in Australia and in Canada. And ultimately, I expect the business will be global. And really, the whole purpose for Reliq, our mission, is to prevent hospitalizations in the chronic disease patient population. So we know that in the developed nations, over 80% of healthcare spending comes from these chronic disease patients. So people who have diabetes, congestive heart failure, chronic obstructive pulmonary disease, kidney disease. These patients are what we call the super users of the healthcare system. And the reason for that is that on a day-to-day basis, these are elderly patients. A lot of them are living in communities with not a lot of healthcare infrastructure, and they may be living below the poverty line. So these are patients who are in challenging situations, and these are very complex clinical conditions. And many of our patients have between 2 and 8 different clinical chronic conditions at the same time. So on a day-to-day basis, they're responsible for managing their own medication. And we know that less than 50% of them take their meds as prescribed. They're supposed to check their vital signs, remember what are the early warning signs and when they're supposed to contact their doctor, and then reach out to the doctor if they start to see any of those early warning signs. But given the demographics around this population, ill, elderly, they're not really very good at taking care of these really complex clinical conditions in the home on their own. And as a result, this population is hospitalized frequently, and they're typically seen in the intensive care unit, which is a very, very expensive care setting. So these patients are responsible for really driving healthcare costs. If you want to move the needle on healthcare costs, it really has to be by reducing hospitalizations in this population. And so we set out to develop a platform that would work with patients really wherever they are, really trying to meet these patients where they currently are, as opposed to asking an 80-year-old who may have memory issues or visual acuity issues or language barriers. We're not asking them to learn how to use a smartphone or an app on a tablet. And we use very simple medical monitoring devices in the home. They can be cellular enabled if there's no internet access in the home or even in the broader community. And we collect data directly from these devices that tells us how that patient is doing. So little interventions in the home, things like if you have a congestive heart failure patient who gains 2 pounds in 24 hours, it means that they're going into heart failure. And if the doctor is immediately automatically alerted, they can call in a change to that patient's diuretic medication and keep them healthy and at home indefinitely. Whereas if the patient is left to their own devices and they have to try to remember that, oh, that 2-pound weight gain, means I'm supposed to call my doctor. A lot of these patients don't necessarily remember to weigh themselves every day if they're on their own. Our system delivers automated reminders and in the language of their choice. And so on their own, they may not remember to check their weight every day. They may not remember what it was yesterday. They forgot to write it down. They can't remember what was the threshold, weight gain, where they're supposed to call their doctor. And so they end up waiting until they start to have symptoms like chest pressure, pain, difficulty breathing. And at that point, when they go into the hospital, they're probably looking at an ICU stay of several weeks, and that's hundreds of thousands of dollars. And these patients come out of those hospital stays worse off than when they went in. So there's permanent damage to the heart or the lungs or some of the other organs. And whereas if we can avoid those hospitalizations by catching those early warning signs right away and alerting their clinicians through our automated alerting through the platform, then you can have these very minor little interventions in the home that have a tremendous impact on long-term health outcomes, quality of life, not just for the patient, but also for their families, and a dramatic reduction in healthcare spending. So it's really kind of a win-win-win for the patients and their families and for us as a company. But it's also a win for clinicians because Medicare and Medicaid have introduced very compelling reimbursement and financial incentives, essentially, for that kind of virtual care, the proactive preventative approach. So a typical physician practice can generate over $1 million in new revenue a year at very high profit margins by deploying our platform. So it really is something that benefits everyone. The healthcare system saves money, even with that investment in incentivizing the clinicians. Medicare is still saving about $18 million for every 1 million that they deploy to encourage physicians to adopt proactive preventative care. So it's a very interesting dynamic where something that's sort of relatively simple and kind of common sense can have such a dramatic impact on patients' lives and also on the healthcare system.
So, I mean, to me, it sounds like a win, 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 right? Better for the patient, right? Better for the clinicians, better for the hospitals, better for healthcare costs overall. Right. Pretty big deal. And this whole chronic space is really kind of a space that other companies really kind of want to just try to avoid.
It's interesting, especially the Medicaid space has been one that companies have traditionally stayed very clear of. It can be very difficult to make money in the Medicare, Medicaid space, but that has changed since 2018 when we first started working with patients. At that time, there was one billing code for remote patient monitoring, so one virtual care billing code, and that was worth about $59 per patient per month. There are now, this year, there's over 23 billing codes for various kinds of proactive preventative virtual care that are enabled by our platform. And the average clinician can make around $400 per patient per month in new high profitability, high profit margin revenue by deploying our platform. So Medicare and Medicaid took a very proactive approach. I mean, they were among the first in the world to really start to kind of mandate this proactive preventative approach. And it's been extremely successful. I mean, every year since 2018, Medicare and Medicaid have expanded the programs, increased the number of billing codes, increased the amount of the existing reimbursement around existing codes. So even this year, there's been an 8% increase since 2021 in the reimbursement levels for existing billing codes, and 5 new billing codes have been introduced to cover new conditions like asthma and musculoskeletal issues, which were previously not covered. So there's clearly, Medicare and Medicaid are typical insurers. They make their decisions based on, what's going to save them the most money. And it's very clear that this virtual care approach that's really focused on prevention is extremely effective. And so even, making these upfront investments, Medicare and Medicaid have been able to document for themselves that the savings, not even that far down the road, are really tremendous. Excuse me.
Okay, so let's talk about how you got some validation a few weeks ago, right?
Yes. So, we were very fortunate to sign an agreement with Cognizant. A lot of people won't have heard of Cognizant. It's not a household name, but it is a multi-billion-dollar multinational. So they have a global business. They have 4 business units. Healthcare, their healthcare business unit represents about 25% of their revenues. Their annual revenues are around 15 billion, and their market cap is just below 50 billion. They're a Fortune 500 company. They're actually, I think, number 186 now. So, Fortune 200 really. So they're extremely well known in healthcare if you work in healthcare. So especially if you work in IT in healthcare. So they're very credible, very highly respected company that provides IT services in healthcare. And they are connected to over 85% of all Blue Cross Blue Shield health plans and manage all of their billing. They act as a clearinghouse for Medicare and Medicaid claims. They connect to integrate with 650 different electronic medical records and electronic health records. And they're looking to grow the healthcare side of their business and do that by really looking to innovative ways to provide their clients with solutions that they're asking for. And so for us, partnering with them gives us an opportunity to access these very large health insurance plans, hospital systems, healthcare systems, and also managed care organizations that are current clients of Cognizant, so that we can supply what they need in terms of remote patient monitoring, chronic care management, and behavioral health integration, transitional care management, principal care management. And Cognizant has a care management division themselves where they actually supply those medical assistants, nurses' aides, and nurses who will do the care management piece for the insurers and other clients. So it's a very good partnership where they're working with us, really provides us with kind of the good housekeeping seal of approval in healthcare. So it's something that I think de-risks us as a small company from the perspective of these very large clients. If Cognizant is willing to work with this company, Cognizant's famous for being very conservative and for really doing a lot of deep due diligence before they work with a company. And so the fact that they have decided to work with us, really does speak volumes to a lot of these larger clients that we're going after. But also
which
because
is opening the door for you, right?
Right. It opens doors for us tremendously. And they also, Cognizant, through their care management division, are able to help us scale up on the human resource side. So our platform is very scalable. Most of our onboarding process is fully automated. So we can scale the software as a service piece very quickly and easily to millions of users. But the piece that the larger clients tend to be concerned about is you're going to have to hire a lot of new care managers. How quickly can you address a very large patient population for us? And so partnering with Cognizant, there's no concerns there. They have a very, very large care management business. And so they're able to scale to clients, to serve clients of any size. So it really kind of addresses, that partnership with Cognizant addresses the two biggest concerns that would have prevented us from getting large clients. And that is, how quickly can you scale the human resource intensive part of the business? And, how do we know that this company, this little Canadian company, is actually got something worth deploying? And having Cognizant seal of approval really answers that question for the clients that we're
yes, that's very exciting stuff, right?
Yeah.
So just to reiterate, because anybody that's followed me for any amount of time knows my favorite business model is the reoccurring revenue software as a service model, because it's typically very high margins and very predictable, steady income, which I happen to love, right? So let's talk about the financial position of the company right now. How are you looking on cash? How's the burn? I mean, what are we looking at here?
Yeah, our burn's quite low. We're at, I would say, less than 500,000 a month in terms of our burn. And that's really because we have largely built out the platform. Obviously, we continue to improve it based on customer requests. And as platforms like iOS and Windows are updated, we obviously want to stay current with all of that. But the bulk of the heavy lifting around the platform is done. So, and that helps keep our costs low. And we built the business specifically so that a lot of the processes around onboarding clients, like clinicians, as well as onboarding patients, would be very automated. So it's very low cost and very scalable without requiring a lot of human resources. We are at a point, by the end of this quarter, we'll be completely self-sustaining, cash flow positive. By the end of the year, I think we'll be starting to throw off a fairly significant amount of free cash. And, we'll have to look at things like share buybacks for, what's going to give our shareholders the most value from having that. free cash in hand. But, we're at a point where, and I've said this consistently for quite a while now, we're definitely not looking to raise money. We don't need to raise funds in order to fund our operations. We are able to do that ourselves. So I think it's a great position to be in as a company. And I certainly think, over the rest of this year, you'll see a lot of very significant growth and a lot of revenue growth, without a doubt. And so I think our cash position is just going to continue to improve steadily from here.
So how many total shares do you have fully diluted out?
Yeah, so fully diluted, I think we're at about 190 million. So there's definitely room for, some share buyback down the road.
Okay. Or what would probably happen, and this is just me thinking out loud, but when you go to uplist to the NASDAQ, right, maybe there's a reverse split, which I don't have an issue with, by the way. I like reverse splits, actually, because it takes a big chunk of that outstanding share count and reduces it down, and then you get a nice small float, right?
Yeah.
And
Yeah, I'm not morally opposed to share buybacks reverse splits. What I am sort of opposed to is when people do reverse splits, because that's the only way they can meet the minimum threshold to uplist. So I think, we could definitely see ourselves reaching the point where we qualified uplist on the NASDAQ, but choosing to do, just like a 2-to-1 reverse split in order to get
just to give yourself the cushion.
Right. To get up into that kind of, $8 to $12 range where you do command a lot more attention on the NASDAQ. So, I think it's really important that before you uplist to any exchange, you know that the company is growing rapidly and, really should be on that exchange and will be able to continue to deliver, good news and growth once you have uplisted, so that the uplisting itself isn't, intended to be a value creating event. It's just the logical step in the company's evolution.
See,
and
we had this conversation last time, and and everything you said was music to my ears, right? Because you don't want to just uplist to uplist. You want to uplist when everything is firing on all cylinders, right?
Yeah.
And there's no sign of a slowdown, and you're not just uplisting to get to uplist. You're uplisting because you deserve to be there, right?
Yeah.
It's the companies that uplist probably too prematurely, and then they wind up battling to stay listed, which consumes an immense amount of time.
Yeah.
And it's not worth it. To me, it's not worth it. Right. So your approach is the smart approach, which is.
Yeah, I think having a private. Yeah, I think having a private company background helps in that, I think when you run private companies, you have to be very, very focused on operations, because if you don't build a company that has true inherent value, you'll never sell it and you won't have that exit. And that's your liquidity event. In public companies, there are things you can do with financial engineering, uplisting to a new exchange or doing reverse splits or things like that, that can sort of artificially inflate a share price, but that ultimately do a lot of damage to the company and don't deliver value to shareholders. So, we still have, I think, internally that private company kind of bias where we're very focused on operations and building, a really successful venture that will continue to grow very rapidly for the foreseeable future. And there are milestones along the way of that, including, an uplisting that make sense as part of that journey, but aren't the point of the journey. They're just kind of a logical offshoot of executing on our plan.
As far as proprietary technology, it sounds like to me, you guys try to make it as simple as possible for the patient, right?
Yeah.
But so I'm wondering, well, how is that protected, right? Does that make sense?
Yeah, so this isn't the first software company I've run. The last company I ran, VitalHub, was also software for healthcare. And I definitely believe in protecting software as trade secrets as opposed to through patents, because patents often are more kind of a hint for how another company can develop something similar than they are real protection. But I always say, we give our patients a very low tech experience because that's what they're comfortable with. But the technology that powers our platform is cutting edge, and very complex. So, we have built something that's, technically very unique and powerful, but we don't want our patients who are elderly and ill to have to embrace technology in order to be able to take advantage of,
which is a fantastic
services.
thing. Because as I think about my mother, there's no way in hell she is going to learn how to use a smartphone. It's not going to happen.
Yeah.
She's got a flip phone. She'll have a
Yeah.
flip phone for the, I mean, that's it. She's never going to have a smartphone. Doesn't want a smartphone. Doesn't want to learn how to run a smartphone.
Right.
Very frustrating for me, but I totally get it. Right. I mean,
and it's very typical. I mean, my Nana, when she died, was in her 90s and, living on her own at home right up until very close to the end. And we got our whole family an iPad, but it was very difficult to teach her how to use it and, to get her to remember to leave it plugged in or even where she put it. So, if you have those kinds of constraints on your system that the patient has to learn to do something they're not comfortable with, you get very low adherence. So one of the most common things we see with remote patient monitoring, chronic care management, all of the virtual care, is that the typical companies, the typical products have very low utilization and very low long-term adherence, whereas we have over 98% long-term adherence. We're talking over periods of years. And that's really important because, if you don't get the data from these patients, you can't make clinical treatment decisions that will keep them out of hospital. But also, it's very rare for a company to have that kind of long-term data on patients. A lot of what's historically been done in remote patient monitoring is just the first 30 days post-discharge from hospital. So the fact that we've had patients on our platform for years, and we actually see that adherence improves the longer they're on it, because they really do start to see, gee, when I check my vital signs every day and I remember to take my meds every day, I feel better, I do better, I don't go into the hospital, I don't get sick, and I have a much better quality of life. So it's kind of like the longer they're on the platform, the more engaged they are with it, which, patient engagement is the number one predictor of health outcomes in this population.
I mean, to me, this is like such a fantastic story, right?
Yeah.
And I think it's very under followed.
Yeah.
I don't think, a lot of people are aware of this story, but I think it's just I think it is a really, really exciting story. And this is like this is almost like an inflection point for you guys, which could be pretty profound over the next couple of months, right?
Yeah, no, there's no doubt we're at an inflection point. This year's going to see very significant growth. We've provided projections around that, what we expect to hit. And I think, we've to some extent consciously really been flying under the radar to this point, just focusing on the business and really capturing market share and focusing very much on acquiring clients and just continuing to expand our footprint. But this is the year where I think we're going to start to reach out more to investors, particularly in the US, who I think really understand our business because you grew up with the Medicare, Medicaid system around you. You understand those dynamics better than those of us who maybe come from other countries with socialized medicine. And we're fortunate in that over the last few years, Medicare and Medicaid have really seen the economic and health impacts of preventative care and virtual care, particularly during the pandemic when, a lot of clinicians were forced to use virtual care when they really hadn't ever previously done anything virtually. So I think we're in the right place at the right time, not by accident. We definitely set out into this market with a goal of providing better care, particularly to underserved patient populations. But we are fortunate that Medicare and Medicaid have really evolved quite quickly for particularly a large insurer. They're the largest single payer in the world. And they've been very proactive around this kind of preventative approach, and the billing codes, the financial incentives have followed. They've also introduced penalties for clinicians whose patients are hospitalized more than the typical Medicare or Medicaid patient. So there's a lot of incentives.
Which is actually an incentive for places to migrate to somebody like you, right?
Yeah.
And there's
absolutely there is.
Just so we're clear, I mean, is there anybody else out there that does what you guys do? Or I
Yeah,
mean,
so we focus on the Medicare and Medicaid patient population, although we'll also be working with insurance companies, but other companies that have sort of a similar mission. If you look at Livongo, which was acquired by Teladoc, they focus on employer-sponsored health plans. The price points are much higher there, but they're much more human resource intensive businesses. So they primarily focus on type 1 diabetes, which is at 10% of the diabetes market. We primarily focus on type 2, which is 90% of the diabetes market, as well as all of these other chronic conditions. And those companies that focus on the health insurance plans, it's a completely different patient population. So these are people who are working age, so typically under 65, whereas we work with patients who are often 75 and older and are really quite sick. And so, the companies that we see in the market tend to be more like a Livongo, more focused on the employer-sponsored health plans, and it's more human resource intensive. They do a lot of coaching with patients. So it takes a lot of people, which means that even as you scale, your margins stay quite low. Teladoc and Livongo have single-digit EBITDA margins, whereas we'll have 45% EBITDA margins at scale this year. And we're already at, around a 75% gross margin. And so, we set out to serve a population that has not traditionally been particularly attractive to companies. And as a result, when we go into clients, no matter how large or small, we're never competing head to head against another company. There just isn't another company in the market that offers the comprehensive suite of services we do that works within the Medicaid and Medicare system constraints. We do all of the pre-authorizations, electronic pre-authorizations for patients on behalf of our clients. We can do electronic claim submission. And we do it all at a price point that really works for the community, where hospitals can come up with millions of dollars up front to install a system and millions of dollars a year to maintain it. That budget doesn't exist in the community space. And where traditional system will require a hospital IT department, which has dozens of developers to support the implementation and ongoing maintenance. Our system was designed from the ground up to work with individual physician practices, home health agencies, long-term care facilities where there's no IT support. So it really, there's a lot of complex technology that went into it, but all with the goal of it being incredibly user-friendly and intuitive for both the patient and the clinician. And that's really, I think, one of the key differentiators for us. Most clinicians hate every IT system that they have to work with, but they really enjoy using ours. And it's very simple and very easy to deploy. There's really no kind of downtime for training. So, I think we have something quite unique. I grew up in a hospital where it was primarily chronic disease patients. And I think brought that bias, as did a number of our other, founding team members, of, really understanding the chronic disease patient population and what care in the community looks like, and designing the platform accordingly. And historically in healthcare, everything's really been aimed at the acute setting, so hospitals, because that's where the budget was. So I think we've got a pretty good head start. And in healthcare, that really does make all the difference, being kind of first to market and establishing yourself as the gold standard in the space, as we have.
I'm just thinking here. I'm thinking as you're talking, I'm thinking about the fact that like the CVS and the Walgreens have started doing their, their little check-in areas, I guess,
Yeah.
right? You get the flu shot, you can do this.
Yeah.
But I would think also for them as drugstore chains, right? Because you said their people aren't taking their meds the way they're supposed to be taking their meds and stuff like that. Why wouldn't there be a partnership with somebody like a Walgreens or a Rite Aid or a CVS?
I think that's certainly possible, maybe something down the road. I think the reason we focused on remote patient monitoring, chronic care management, behavioral health integration is because that's really what the clinicians were asking us for. And there are such compelling reimbursements under the Medicare and Medicaid system now. And it is something where we are able to demonstrate clinically, a really significant reduction in the number of hospitalizations and improved health outcomes. It can be a little bit more challenging when you're doing that through a pharmacy, because they don't always have the same ability to track the patient's history and how they're doing going forward. Patients will often fill some prescriptions at the hospital where they were just discharged, and others at the hospital, the pharmacy near their daughters, and others at the pharmacy near them. So, going to something central like a home health agency or a physician practice gives you more insight into the patient's overall condition. And so it's easier to drive those better health outcomes.
Well, that makes sense. This is, so I'm just looking here. How many actual chronic diseases do you guys cover?
Yeah, so I mean, it's quite a broad range, and we can really cover anything that any clinician asks us to. So, we can have cancer patients where we're helping to manage their medication adherence and track symptoms, and we can do post-surgical, so looking at shots of photographs of wounds that are healing to know whether or not a clinician needs to send in a home care nurse to change dressings or debride or that kind of thing. And we obviously do the sort of biggies in chronic disease, so diabetes, congestive heart failure, kidney disease, and asthma, chronic obstructive pulmonary disease, high blood pressure. And we can also do dementia. We can do any musculoskeletal issue. And so there's a very broad range, and we tend to kind of add new modules that will monitor new parameters based on new billing codes that come out under Medicare and Medicaid, because that tends to drive how physicians practice and where they are ready to move to something virtual with the patient.
So when Teladoc first came out, I was like, this is the smartest thing since sliced bread, right? I mean, this is really good stuff. It makes so much sense to me to not have to go into the doctor and just do a virtual, right?
Yeah.
But like you said, the margins have not been right. So this is like this is the virtual play that I think is the sexy virtual. I mean, this is really the
I think this is the
part.
virtual play that can really have the most profound impact on health outcomes. In some ways, it's not at all sexy, because we're working with patients, who might be living in trailer parks on the Texas-Mexico border, and they're using very sort of clunky looking cellular blood pressure cuffs and cellular enabled blood pressure cuffs and glucometers. It's not sort of the flashy app on a tablet that you see on a lot of companies' websites, but it's what the patients will actually use. And it's what drives adherence, and that's what drives better health outcomes. Telemedicine, we certainly do offer virtual visits through our platform. Telemedicine is a component of our solution, but it's really become a commodity. Teladoc is certainly the leader in the space, but by no means are they the only provider in the space. And the reimbursement for physicians for just virtual visits, so just telemedicine, are quite low. So those companies make money by getting a small percentage of the visit fee from the clinician, and as what they charge for the virtual visits. And so your opportunity to kind of improve your profit margins just isn't there. And in fact, what we see traditionally in healthcare is that things like virtual visits and the reimbursement levels on those tend to go down over time as opposed to increasing, because they don't really fundamentally change much in healthcare. They're not going to have a significant impact on reducing healthcare costs. And so, it's a challenging business. And as more and more competition enters that space, it becomes more and more challenging. So I think having something that's much more powerful, and, it may not necessarily, resonate with everyone. There may be people who don't really understand what we do or why it's valuable, but there's a huge market for this. I mean, this is easily over $100 billion market and continuing to grow. The population is continuing to age and to grow, and chronic disease rates, so the percentage of the population who have chronic diseases, increases every year, and largely because we're no longer kind of a manual labor society. It's very tech focused, and we're all quite sedentary during things like pandemics. And so, the rate of chronic disease continues to increase. So this is a market that is very rapidly growing. And there's a real unmet need here where, there haven't been a lot of companies serving this space. So our advantage is, in healthcare, customers are extremely conservative. We have now 4 years of clinical data showing that our platform is very effective in reducing hospitalizations and improving health outcomes. And we also have 4 years of claims reimbursement data showing that our clients do make a compelling amount of money by using our platform. So, any new entrant into the space who had even identical platform to ours is going to have a real uphill road to travel, because healthcare customers like to see that data. They like to buy by reference, and particularly as you get into the larger and larger clients, they want to see a real depth of data. So you do need several years of that clinical and reimbursement data, and we've got that, and that's quite a unique advantage for us in the space.
And you're going to get a lot more of it with
yes, we really are.
Cognizant, right?
Yeah. I mean, down the road, I think data is going to be one of the biggest value drivers for us. So we keep a copy of every piece of patient data that we handle. We anonymize and de-identify it. And really by next year, we should have enough longitudinal data, so historical data on patients, and a large enough patient base that we can start to license that anonymized data to pharmaceutical companies and research institutions, governments. And that's a very lucrative business. This is a very unique data set. Most data that exists in the market that you can buy as a pharmaceutical company is on clinical trials or research studies, where you have patients who are healthy except for the one clinical condition. They're not taking any other medications. Whereas our patients are taking, in some cases, over a dozen different medications every day, and they have multiple chronic conditions, and they may also have things like, depression or gout or cancer. And so you're able to look at a really broad interplay of quite a few different factors, and that data is incredibly valuable. Historically,
any data become incredibly valuable.
Yeah. Historically, any data collected in the home was patient self-reported, so inherently considered biased, whereas the data we collect comes directly from devices, a medication dispenser and things like that. So it's much more valuable data than the traditional data collected in the home, and it's a very rich data set. So we expect to start generating revenues from that in 2023.
I just love this story.
So do we. So, yeah.
All right, I want to talk real quickly about the actual chart. Now, this is for a lot of people, this is where I start to, eyes glaze over and stuff like that. But what's very, very easy to see is that the stock was in a downtrend for multiple years. It has broken that downtrend. This line has been broken, and the stock has really been kind of I call it trading in a box, but it's been in consolidation mode for really since August, right? And we're coming up on March. So when a stock is consolidating like this, it's like I said earlier, it's percolating. But with everything that you have going on with the contract you just signed, and I know that you mentioned before that you're in talks with others that you can't say anything about right now, but you anticipate at some point in the near future, you're probably going to have some news to release. I would think that I actually would have thought the stock, when you announced that partnership, would have broken out of this box, and it didn't, which is fine. The whole small cap, micro cap space has been getting pounded for 9 months. Your chart looks amazing compared to a lot of the other charts out there, right? Because they've just been getting killed. So this is, to me, a very powerful setup. You're above your 200-day moving average. You're above you're above the 50-day moving average now. But if you take out the dollar, so there's a thing called the round number roll, right? When the stock breaks a round number, it's like a big deal, right? At least for traders, because you take out, it's like going from pennies to now you're a dollar stock, right? This is a big deal. And then going from $1 to $2. Anytime you get up into the round numbers, it's always a psychological thing for people. The $1 break is always the most exciting. And I think that's what's going to happen. I think it's going to happen in the next, couple of quarters is what I think is going to happen. And I think you go back up, and I don't know if that is all-time highs on. Yeah, that's all time. So $2 is the highest the stock's ever been. right?
Yeah, that's right.
So, once it gets through this dollar, I think it goes to $2 almost immediately, right? And then you'll have some resistance there at 2 because that was your previous high.
Yeah.
But then hopefully it just kind of works, does another base, works sideways, and then you take out 2. Now you're in blue skies, right? Now you're just in.
Yeah.
Yeah, no resistance.
I mean, I
overhead.
definitely do think we're currently undervalued. I mean, I am not complaining given how terrible the markets have been, particularly, as you say, in microcap and definitely in healthcare specifically. But if you look at our last press release around Datasoft Logic, that's going to add 50,000 patients, 50,000 new patients every year to the platform. So ultimately, they have 500,000 patients. Ultimately, it's going to add 500,000 patients to the platform. So every year, that will generate an additional 36 million in revenue over the previous year, just from that one client. And that large client, we did sign not long after we announced Cognizant. So certainly having that association has enabled us to graduate to, much different level of customer who has a much larger patient population. But, Datasoft Logic on its own at full deployment is an additional 360 million a year in revenue. So these are significant contracts. I think maybe the market hasn't quite figured that out yet, but I think over the rest of this year, as we, report results and also report, new contracts signed, I think, it will come, they will figure it out. And so we're certainly happy to be patient. And as I say, this is a rough market. So, we're not,
I think you're in a
fantastic
position right now, right? You're in the right time, or you're in the right space at the right time. There's another thing. So actually, this is a weekly time frame, but the 50 week has crossed above the 200 week, that would be considered a golden cross. It's a very good, powerful thing. It's a bullish thing. When you have a 50 cross below the 200, that's the death cross.
Okay. We won't do that.
So golden cross is really, really good, right? So look, I think if you are not familiar with the story, you need to get familiar with the story. You need to put the stock on your radar, right? Investor relations, you have a sign up, right? To get investor relation updates sent directly to your email. Do you have that?
I think we're actually just putting that up now, but you can always just email Lytham Partners and their email address at the bottom of all of our press releases, and they'll add you to their list, and we'll have a sign up list on our website shortly as well.
Okay. So what I want to do, we're going to wrap this up today, get the story out there. But in a couple of months, I would like to do a revisit with you and just kind of see how things are going. Sound good?
I think it's a good time to start, sort of following the company. And I think, every few months we'll be able to touch base and provide some pretty meaningful updates. I think that makes a lot of sense.
Okay, great. This is fantastic. Lisa, thank you so much for coming in. Hold on one second. I'm gonna stop recording.
Okay.
And thank you for tuning in to yet another CEO interview here at Alpha Wolf Trading. Today's interview was with Reliq Health Technologies, ticker symbol RQHTF, and the CEO was Lisa Crossley. I hope you enjoyed today's interview, and if you did, do us a favor, give us a share. How about giving us a like? And while you're at it, why not give us a follow? Until next time, stay safe. Alpha Wolf Trading wishes you the very best of success.